I'm Dr. Burnett from Burnett Plastic Surgery. Welcome to the offices of Burnett Plastic Surgery. Today what we're going to talk about is the liquid facelift, which is the use of Sculptra. Sculptra is L-polylactic acid, and it's an injectate that we use to stimulate collagen. Our model today is Marge, and she is going to have Sculptra injected on both sides of her face, and we're going to try to achieve a certain effect. What I like to do is I try to get an idea of what I would like enhanced. In this particular case, you'll see that there's a slight depression here along the zygomatic or the cheek lid area. So we'd like to enhance that area. She does have a full cheekbone here, but there's a slight step off. So we're going to try to do something here. The depression here is cosmetically acceptable here, but we still want to strengthen that area. So you'll see that what I do is I kind of push the skin to get an idea where the most weakness is. If you notice, it's going up and down, so she has weakness in this area here. We're going to try to build that up. So if you look at this as a unit, we're trying to strengthen this area for her. We look at the jowl area, and you'll see that there's a pre-jowl sulcus or a depression here. We're going to fill that as well. So we're going to put some of the agent there. Something that we also notice when we look at a patient is how the orbit is set, and we'll notice that she does have a little temporal wasting, or an area that seems that there's some absence of soft tissue. So what we're going to do is we're going to build here. And alternatively, what that'll allow is the patient to get a brow lift, a simultaneous brow lift. So we look at this area with the brow, so it gives you an idea of what we're aiming for. Another thing, I do like to address this area here, and what we like to do is inject some of the product in this direction, right in the pre-auricular sulcus, or just in front of the ear depression. That allows us to sweep the face upward. Another area that we like to address is the neck, and we find that Sculptra has been very useful for tightening this area. So what we do is we'll put a few small aliquots of the product here to affect tightening of that area. We're going to do a similar thing on this side of the face. Okay, so this is the reconstituted product, the Sculptra, and what I like to do is I like to start my injections in areas where there are no nerves, because there is a anesthetic in this agent, and we mix it with an anesthetic when we reconstitute it. So by doing that, I'll inject the infraoral nerve and the mental nerve right here, so that she gets a certain degree of anesthesia, and it'll allow us to work more freely with the product. We don't have that kind of distribution of nerves in the upper part of the forehead, so here we'll just inject directly, and by having the anesthetic here, she'll get more comfortable as we go along with the procedure. As I mentioned before, our patient will be doing these massages 5 minutes 5 times a day for the next 5 days, just so that we can have an even distribution of the product and allow it to stimulate the collagen in those areas that we injected. And this completes our presentation of the use of Sculptra for facial rejuvenation. Thanks.